All right, everyone, the news is out. I am going back to bedside nursing. Hey everyone, welcome back to my channel. Nurse Katherine here. If you are new here, please consider subscribing and giving this video a big thumbs up, as it helps the YouTube algorithm get this video out there to other nurses or student nurses just like yourself. So what is today's video all about? Like I said, I am going back to bedside nursing. If you did not see my Saturday video about my career update, make sure to go watch that. I will put it up in one of these corners here. But I am going back to bedside nursing. Specifically, I'm going into travel nursing. And my first assignment is on a med-surg float division. But that's not exactly what I want to talk about today. I want to talk about how I will be prioritizing my day in the hopes that this can help you all prioritize your days a little bit better in the hopes of making your day a little bit better. But other than that, let's get this video started. I know a lot of nurses out there get to work early to look up their patients. Well, that is number one thing that I do not do when I prioritize my day. And here's why. I almost feel like it's a waste of time. I have to get to work early, which I'm not even getting paid for, so I don't want to work off the clock. And I just feel like it kind of gives me a lot of anxiety looking up a patient for 30 minutes before I even start work. I'm one of those people who would rather just roll with the punches kind of thing and not list everything that I need to do, because that is overwhelming when it comes to bedside nursing. And look at that, before I even get into my shift. I would rather just look at my patients maybe for about 5-10 minutes once I clock in before huddle starts, and then go with it. Roll with the punches and just prioritize the best you possibly can. The second thing that I see a lot of nurses do that I personally do not like doing is writing everything down. Yes, I think it's helpful to write things down, absolutely, so you don't miss some key active orders that you need to complete. But writing everything down was just such a waste of time to me, because things change so frequently for patients. So one med that you wrote down 30 minutes prior might not even be on that schedule anymore. One order, it could be the wrong order, it could be for the wrong patient, and you realize you have to get that taken off, and now you have it written down. You just wasted your time writing all of that down. So that is a big reason I do not write everything down. Yes, I will write a few things down so I can give a good bedside report to the oncoming nurse, but I am not going to write down every single active order or every single allergy that this patient has, because that is just insane. And I know they do that in nursing school, but it's insane when you are actually a nurse on your own. So now thirdly, you just prioritize your day. Remember your ABCs, of course, and prioritize your day from there, but roll with the punches. Just go with the day, keep an open mind, don't keep this structured, detailed, this is what has to be done every single moment, because things are constantly changing with our patients. I think we can all agree on that. And if you get off schedule, that might give you some anxiety if you are getting off schedule and try to get back on schedule, and then you're fighting with that anxiety all day long about how you didn't stick to the schedule that you had wanted. I learned that early on in my nursing career, that writing this down and keeping this strict schedule was not going to work. Especially when you have admissions, discharges, you have to pick up somebody else's assignment because they had to go home sick, all of that kind of stuff. Just roll with the punches. Hopefully not literal punches, but yeah, that does happen sometimes too. And lastly, when talking about prioritizing, make sure you are prioritizing what you are saying in your bedside shift report. Shift report does only need to take 30 minutes or less. I always try to take maybe 5 minutes per room. I would tell all my patients that shift report was coming up, that this is a time that the nurse and I get to talk together with you. If there's anything that I have missed, let me know and we'll add it into this report, this bedside shift report. But This should not take 15 minutes per room because that nurse doesn't have time for that and you do not have time for that because you need to clock out and get home. So when you are prioritizing what you are saying, of course use SBAR. What's the situation? Keep it brief. What's the background? Keep it brief. You do not need to go into this whole 20-minute conversation of why this patient is here. Next is assessment, and that's super brief as well. Just tell them head-to-toe assessment, what your findings were, and keep it short. Lastly is what you recommend. What needs to be done yet? Is there something that you had missed or something that you could not complete? Do they need a bath still that day? Do they need to walk around the unit just 2 more times if that was the goal for the day? Tell the nurse what you recommend doing and keep it brief. I am super excited to use this MOXIE PRN book. Some of you may have seen I was giving one of these away in a giveaway. I cannot wait to use this thing. So this is like your own personal report sheets. Let me try to get this closer so you can see. And it has tabs here. This is for one patient. This is another patient, another one, and it goes up to 6 patients. So it's perfect for med surge. MOXIE PRN also does it for ICU, mother baby, I believe as well. So I have never used this. I'm super excited to use this. This is not an ad in my video and they are not promoting this. I am just personally telling you I am very excited to use this, as this would be very, very helpful in trying to give report because it keeps everything so organized. You can see here how organized it is. So that'll be awesome, and it's reusable, which I really enjoy, and you can write on it with Sharpie. And that's even better because we all carry Sharpies on us anyways. And then you just erase it with alcohol pads, which we all have. So it's really perfect. It was created by a nurse, actually. You can see a link in my description below if you're interested in this. I will give you an update of how this is going once I start my job, which yesterday was my first day of orientation. And I probably, when this video is being posted, I'm probably on my first day of night shift there. So yeah, just make sure you are subscribed so you can see my update of using this. But this is very helpful in prioritizing what needs to be said to that next nurse because it's laid out very well and it keeps you just to the point. So that's how I will be prioritizing my bedside routine. If there are any tips or tricks that you have for new grads or students or just seasoned nurses, comment those below. I would love to hear it. I haven't been in bedside for 10 months, so I'm finally going back to it, and it may be a little bit of a struggle. So we'll see. I don't know. I'm just gonna roll with the punches and pray that the Lord just gives me a peace about what I am doing. And yeah, just lots of prayer is going to be behind this. So yeah, that is it for today's video. If you liked this video, please give it a big thumbs up. Do not forget to subscribe to my channel and hit that little notification bell so you know when new videos are being posted. Other than that, that's it for today. I will see you guys in Saturday's vlog styled video.